Hello, everybody. My name is Dr. Nicholas Welch, and I am co-founder and medical director of the Trusted Care Network. And we're here today to explore some of the world of alternative medicine and to focus on the role and the emergence of medical marijuana. You know, why we're here as an audience is largely due to the shortcomings that exist in traditional medicine and to search for an organic therapy that works with our body the way it's naturally designed without the pharmaceuticals that have this polypharmacy, side effects, medical regime changes, and all the complexities to come with that. Now, don't get me wrong, there's absolutely a paramount role for traditional medicine in nearly every ailment. However, to work with organic things, the substances that give your body the natural energy, the natural power, and the support to heal itself is truly the purest form of medicine. Now, I say we a lot. You're going to hear that a lot. And you might wonder like how I'm putting myself in that we category. Let me tell you a little bit about myself. I spent nearly 9 years in the military. During that time, I did multiple combat tours. In 2003 and 2004, I was severely injured while on deployment. And during that time, I broke my hip, knee, ankle, shoulder, elbow, neck, and back. I've had 31 surgeries since then, countless procedures. And as a result of that, I live in pain. I live in pain every day. I've seen the fear in my children's eyes when they've seen me writhing in pain. I've seen the devastation and the endless hurt that my wife has endured through all those surgeries there by my side, holding my hand. And anybody who's been in chronic pain knows that everything about your internal psychology and the way you respond to it changes. It goes from dealing with the pain, from ignoring the pain, to resenting it. And I've been there. I've walked that path with you. I have been on pain medications for 17 years. I have undergone the derision from doctors or emergency rooms. And I've walked in those shoes. So if there's two things that you take away from this seminar today, is that one, a greater understanding of the benefits and posterity of medical marijuana and how it treats and its side effect profile and other alternative medicines, and two, that I have the sincerest desire to help you on your journey. Aside from the pain, I experienced PTSD pretty substantial from my combat tours, and I have sought medical treatment for easing of those symptoms, and much of it has been either incomplete or ineffective altogether. So I have walked in your shoes, and maybe you've done a little bit different, but I have the unique lens and perspective of both a patient for the better part of 2 decades and then 11 years in medicine. I'm an advocate for you. Now, also understand that ethical standards and legal standards are an absolute imperative for me. The reason we do that is, with medical marijuana emerging, the only way we're going to sustain it as a trusted and utilized medication and medical regimen is if we treat it as such. So the state of Ohio has 22 qualifying conditions. All right, it's pretty broad. There's a lot of medical ailments that will fit in those categories, but having records of diagnosis and treatment is one of the critical steps to what we're doing. We'll get into that a little bit more later. I just want to impart that again, my role, my life, my mission and vision is to help you in every way possible. But we do have to do that within the highest ethical and legal standards. Let me tell you a little bit about my team and why it's so important. We have, aside from myself as medical director, Steve Cass is our CEO, and Chris Schiavino is our Chief Financial Officer. Mark Boudreau is our Chief Technical Officer. Now, they all have titles, of course, but I have worked with these three men for a number of years on different projects, and I have grown to know and love them and trust them intrinsically. And you think, why does that matter? Let me add my wife, Nicole. You see my beautiful wife there. She's our chief administrative officer. She's the one that's developing our administrative pipeline. And then my father, who's not listed here today, is our director of research and new state development. So if you look at this, it is a family. The reason that that matters is I trust them intrinsically to share my vision, to broadcast our message, to stay on point as not only the trusted care network, but a practice of compassion and empathy that is the bedstone of our practice and our national presence as we move forward. We are a trusted care network. And that seems like a name. We started picking out names a couple months ago, or I'm sorry, about 4 months ago. And we were trying to figure out exactly, all right, where do we land? We wanted something that didn't just say marijuana. We didn't want to have the implication that that's all that we're here for, because it's not. So we went through a few, and Steve hit with Trusted Care Network. And I felt like that name embodied what our mission is and how we're going to fulfill our promise to patients. U.S. patients should demand any practitioner hold the same standards as traditional medicine. And that is exactly what we are here to do. We are here for you, but within the confines of the medical practice. And it's what you should expect because it's what you deserve. So we're so much more than a name. We are committing our life and our energy to helping you on the whole. So when I say our team is a family, that's so imperative that we all have those endemic values of trusted and compassionate care. So now we talked about that. Let's move forward. Let's talk a little bit about medical marijuana. Okay. This has, there's a couple types. We're going to go into the different strains and all that and how they work. But we need to talk a little bit about the history and why it even is taboo and why it's taken so long to move forward and bringing this back into mainstream. So starting back in the early 1900s, and it's kind of, I'll tell you a little thing, so if you probably heard the term ganja, generally as a Jamaican strain, the reason that exists is medical marijuana, or marijuana, has been used for its medicinal remedies for as long as recorded history. You know, the Indian cultures have used this for centuries, if not thousands of years, and they've used it both for ceremonial. They also use it, excuse me, for its medical and medicinal properties, as well as recreational. So the Hindi word for hemp, which is the fiber type plant, is called ganga, G-A-N-G-A. But in the early 1900s, when British colonials brought indentured servants that were Indian to Jamaica, they brought with them the marijuana, which then, you know, through time and vernacular changed from ganga to ganja. Anyway, fun little story. But still going into the history, you know, marijuana specifically was used as like a parenthetical cure-all in the United States in the late 1800s, early 1900s. And it wasn't until the 1930s that when patented medications started emerging, is when marijuana started falling off. And you ask why? It had nothing to do with its efficacy. One of the problems is you cannot patent and make proprietary a naturally occurring substance, right? Same kind of concept with being born with a silver spoon in your mouth. A lot of people think that means just being born wealthy and privileged. What it actually means is in that same time period, when children had an infection, the doctor or the house nurse would put an actual silver spoon in their mouth, especially if it's an oral respiratory infection. And that silver actually had antioxidants and antibacterial properties that would help cure the infection. But it was silver. Silver is a naturally occurring element. So when patented medications started coming out, penicillin first, boom. Anyway, so the silver spoon in your mouth actually means being born healthy and in good, just kind of good health overall. But the thing is that in that time, only people of well means could see a doctor. So that's really why the association's there. Anyway, doesn't matter. Just thought it was interesting. But In the early 20th century, it started falling out of favor. And the reason that it really started becoming illegal at all was that the only people that really used marijuana were black jazz musicians in the South, and as well as Mexican immigrants that brought it up to work in the United States. They brought it with them. So really, it was deeply bedded and rooted in, so I'd say, some racially motivated political platforms. So in the 1937, they passed the Marijuana Tax Act, which made possession illegal. Now, it did this, it had nothing to do with its medicinal properties. It had nothing to do with its danger. It had nothing to do with any medical evidence whatsoever. It was just seen as something that the lower class used, so it was made illegal. Now, it wasn't truly enforced. Then you kind of flash forward to the 1950s, 60s, 70s, and think about it. What was marijuana associated with back then? It was the counterculture, right? It was all the people moving west in California that really opposed kind of this, they were disenfranchised, and then they didn't really support the war in Vietnam and Cambodia. And so they really broadcast, and they wore the tie-dye with the medical marijuana leaf and the peace signs. And Richard Nixon, in the heat of Vietnam War, saw this counterculture as very derogatory and very destructive in his mind to, you know, the wholesomeness of America. So in 1970, under President Nixon's guidance, the FDA created what was called the Controlled Substances Act and put marijuana on it, because even though there was no documented literature evidence to support this, suggested that it was had a high abuse potential and really kind of imminent danger to public health and safety, and had was highly addictive, which I think we all know none of that is really true. Okay. But it was listed with the likes of methamphetamines, LSD, which happened to have been invented by the CIA, and funny, heroin. Now, in early 1930s, I think it was around 1932 or 33, Bayer Pharmaceuticals came out with a medication that they claimed had heroic pain or analgesic or pain relieving properties. Heroic properties. Heroin. Bayer invented heroin. And that's, anyway, but they saw how addictive and destructive it was. And so it was listed on as a Schedule 1 narcotic. Schedule 1 narcotic means that has no, aside from its danger, aside from its addiction potential and abuse potential, Schedule 1 narcotics have no medicinal value. However, there is a litany of literature that shows that there's at least medicinal properties for marijuana, for breakthrough and epileptic seizure disorders, as well as palliative care, as well as an appetite stimulator for those with cachexia and chronic wasting, failure to thrive type scenarios. So we've already debunked that. So why was marijuana listed as a Schedule 1? Mostly because Richard Nixon saw it as counterculture and didn't support American values. So boom, he put it in the corner and couldn't come out to dance. So why does that matter? Well, when it's listed as a Schedule 1, no university that receives any type of federal funding can do research on it. There's no federal funding research money available to do it, as well as having the literature reviewed, published. There's very little motivation to do this. There was no funding to do it. And so, in effect, we've been robbed of 50 years of research to find all the medicinal properties, all the beneficial effects of marijuana. So here we are. We're finally starting to see some breakthrough. We're starting to see kind of this national emergence of decriminalization of United States, of people using medical marijuana, and it's just accepted on the whole by or beginning to be accepted on the whole by medical professionals as a optional remedy. Okay, and to this date, there are millions of people that are already using it, and this number is just growing daily and weekly and monthly, and I'm so happy to see it. Just dropping back to the reason I was approached last year, about mid last year, with a practice that asked me if I was interested in doing medical marijuana. And, you know, at the time, I'm sure you can hear my Southern drawl and my military background. I said, you know, I don't really, I know it's emerging, but I don't really know that much about it. So I said, let me do some research and get back to you. So I read a couple books, took about 6 weeks, got my hands on as much literature as I could read. And I'm a believer. It blew me away. And it really frustrated me as to why this has been taboo for so long with absolutely for no reason. And there's so many people that are suffering. Opioid crisis, this was a big deal. We did have to get this under wraps. It was serious, it was dangerous, people were dying. But that overcorrection now has left just this plethora of people that are in pain. And it's just, I'm sorry for you guys. I live in pain too. I'm fortunate to be able to treat that. But there's so many of you out there that are just deflated and defeated. We're here to help. And I became a believer because I got educated. I educated myself. It's what I'm going to continue to do. I'm going to put out 3-5 minute little kind of TED talks, so to speak, on our Facebook page and share it on our website, kind of debunk some of these myths, educate you about all the different types of medical marijuana and how to use it, as well as things like the turmeric, the kratom, the CBD. Okay, so let me jump in. Let me talk a little bit about marijuana specifically. All right, there are 2 strains. Now you hear all these different things about, oh, there's hybrids and it's 2 strains. There's sativa and there's indica. Okay, now we'll get into more because there's crossbreedings of those strains that give different balances to treat different things. And I think it's amazing. It's amazing, but it gets sticky and tricky. So let's talk about sativa. Sativa is one of what's called a narrow leaf type. It is the drug type plant. When we talk about anything, let me just stop for a second. There, you hear all these CBD and then you hear THC. CBD, cannabidiol, has a lot of excellent properties, and some medical literature is coming out to really support it. There's been a tremendous amount of medical evidence. It's been authorized to be tested. Funding is available. The thing about CBD is when it's sold outside of a dispensary, outside of a recommendation or a prescription, I guess, so to speak, it contains less than 0.03% of THC. So such a negligible level that it wouldn't even register on say a urinalysis or a urine drug screen. But a lot of times you will see kind of targeted advertising that says it has THC. Well, it does, but it's almost like dropping some oil in the ocean and saying it's totally polluted, right? It's just so minimal that but anyway, but that's not to say that CBD doesn't have incredible properties for anti-inflammatory, for breakthrough seizures, and an anxiolytic, which is like anxiety, as well as antidepressant. And so, and we're finding out more and more and more, but CBD does not have a psychoactive component, okay? You can't get that high or head rush feeling from CBD. And there's nothing illegal about it. You don't need a prescription. So, you know, people with chronic pain, that's going to be part of the recommended regimen. Okay. But so when we're talking about these different strains, we're talking about the drug type plant that it will have a little bit of CBD, but it's going to have a much higher portion of THC, which is the psychoactive component. Now, there's different ways in which you take it. And we'll talk about that in a little bit because you'll get different feelings and different affects. But let's go in again, sativa. So this is the narrow leaf type. The sativa strains are your daytime. These are your alert, you're energetic, you're creative. It reduces anxiety and stress. It does help a little bit with the pain, but it doesn't help it in the way that it actually blocks pain signals. Kind of just makes you not care about it as much. So you get that focus and that. This is your wake up in the morning and let's rock kind of strain. The indica, which is kind of the antithesis or the photonegative. Now, this is much better for pain, but it also has that relaxing, help you sleep, actually helps your appetite. So when you hear about like getting the munchies and stuff, a lot of that has to do with the indica. So this is more of your evening, nighttime. All right. Now, if you think, all right, well, that's super simple. Why do I need a medical team to tell me, oh, I want the indica or I want the sativa? It gets deeper. Okay, so marijuana, any of the THC or drug type plants have something called terpenes or terpenoids. Now, each of these, if you look, we've got myrcene, alpha pinene, we got caryophyllene, limonene, humulene, and linalool. It's kind of hard to say, especially with a draw. But each one of these have, for anywhere from 3 to 5 specific benefits. And this is freely published. Please, I implore you all to do your research, to educate yourself. But these have and these are all these things are also found in different things, and where like alpha pinene is in pine needles. You see the myrcene in mangoes and so on, right? So these are things that do exist naturally, both in our diet and in the world around us. And our body is specifically designed for them. I'll go into it in a minute. But if you look at all these terpenes, you will see that each of them have anti-inflammatory and oxaloic. Some of them are even anti-cancer, anti-tumor, antidepressant. I mean, and these have been shown both anecdotally and through history to have these properties and do exactly what they say they're going to do. But still, all right, you think, well, pick indica or sativa, and I want the limonene. Okay, why do I still need a medical team? It gets trickier. You've got to find the right balance for pain, anxiety, depressant, convulsant, insomnia, bacterial, fungal, all these different things. And you can't pick sativa and indica by itself. You can't pick alpha pinene by itself or caryophyllene. There are balances, there are constituents, there are ratios. There's ratio between the THC and CBD. Do you want a 16 to 1 or a 16 to 4, or which would be 4 to 1? It's not that simple. Do you need a daytime thing? All right. Do you need a daytime and a nighttime? Do you need to be more lucid during the day and can't have anything that's affecting you or impairing you? So maybe CBD or kratom. Turmeric should be a daily regimen if you have inflammatory, like arthritic pain, stuff like that. So to just pick the medical marijuana for day, night, afternoon, for one symptom, for a host of symptoms. If you just look at pain, excuse me, there's 3 types of pain, technically 4. There's nociceptive, which is really kind of musculoskeletal or myofascial. Neuropathic, which has to do with nerve pains and all the different nerve fibers, whether it be pain and temperature, which is your spinothalamics, or deep pressure and vibration, which is your dorsal column, medium lemniscus. And I know they're all crazy words, but even your pain has like 6, 7, 8 different types of fibers within them. So, which medical marijuana, if you look at something like fibromyalgia, I had a patient ask me about that one time. Fibromyalgia, we don't know the origin or genesis of it, right? And it has all these different types of pain. I forgot to mention visceral or stretch receptors in your organ systems. Fibromyalgia has a blend of almost all of these, nociceptive, neuropathic, visceral pain. So what do you treat for that? You can't take a single remedy. The opioids, which are really the best ones for your organ, your visceral pain and a lot of your nociceptive pain, those are almost impossible to come by now. So then, there's always something missing. But if you look at the balance of these terpenes and the different strains of medical marijuana, and then you factor in using the turmeric and CBD for anti-inflammatory, and the kratom for energy, pain, and mood, and then you take all these different balance of terpenes and terpenoids, it gets complicated. It's why you need a medical team that is going to help guide you and construct this comprehensive plan. That's why we're here. That's who we are. We are not, we're not just here as another medical practice focusing on medical marijuana, okay? As a trusted care network, we're here specifically to help you. We're here as an advocate, as somebody who looks at you and says, all right, based on your symptoms, based on your arrangement, you may have to go to work during this time, so we recommend this mix, this blend. When you get home, you have trouble sleeping, we create a customized and tailored recommendation from you, from somebody. If you're seeing this and you're signing up, you're either going to be with myself, more likely me, or Dr. Fred Slezak, which I meant to mention him earlier. This is a man, 43 years as a colorectal surgeon in the state of Ohio, who at the end of his career started really digging into this medical marijuana and has become my guide and mentor in driving towards literature to education, understanding to best serve our patients. He served as medical, not only a clinical surgeon or a clinical professor at a university, again for 43 years, but he also served as medical director for a couple of the largest medical marijuana programs, both in the state and the country. The guy just knows everything about it. So he's helping bring me up to speed. I feel like I got a pretty good handle on it, but he's introducing me to an entire new level. So either myself or Dr. Slezak. So I'm hoping to say that in our practice we have some of the most in-depth and committed physician practitioners to be here for you, that are very passionate about what we do. In that recommended evaluation, we're going to also help you obtain your documentation, obtain your medical records, walk you through the process, and then we're going to schedule an appointment for a medical evaluation, again with myself or Dr. Slezak. Every patient's different. Every cluster of symptoms, every person's physiology is different. So we can build off our matrix what we think is going to work best for your life and for your body and your physiology, but everybody responds to things differently. So the only way to find that out and to make changes is follow-up. And I charge you, I implore you to look at the other practices and programs out there. There's a follow-up. It's 1 year for the renewal. But this is a medical practice. How do I know if what I recommended worked for you if I don't follow up? We want to provide you with a journal to track your daily, what works, what doesn't work, what symptoms are still kind of reverberating, what's not being treated to its maximum potential. And if we don't follow up, we don't communicate back and forth with that, how in the world do we know what we're doing and recommending is working for you? And as I said 1,000 times over, this is a medical practice, but me personally, my mission and vision is you as a patient. I want to help you. And I can't help you if I only hear from you once a year. Unless everything's going perfect and that's all you need to communicate. But I have a suspicion that, a lot of people that are getting into this for the first time, they're going to need that help. They're going to need a communication and a dialogue with their practitioner provider. And that's what we're going to provide. Along with that, just as a practice, we're going to be putting out a monthly newsletter with the latest literature and evidence on medical marijuana, new laws, regulations that are coming out, just to keep you as the public informed. I think, again, let me tell you, I run a scout troop. I'm a scout master with my son, and I teach them a lot about first aid and trauma and emergency and all this. And they, I've always seen them have their little trauma bags, their little first aid kits. And I tell them, guys, what do you think is the number one, if you could pick one thing to put in your emergency first aid kit, what do you think it'd be? And of course, I've heard bandages and tourniquets and I mean, it's mostly that, but splinting stuff and ace bandages. And I said, every one of those things can be obtained from the world around you. I mean, you got a tourniquet, you can use a belt or a shoestring or a shirt, bandages, shirt, all this kind of stuff, right? The one thing, if you can pack one thing, it's knowledge. It's knowledge to know that you could use your belt or a shoestring for a tourniquet. It's knowledge to know what to do for a sucking chest wound. It's knowledge. Everything else can be gained and gleaned from the world around you. So that monthly newsletter, And then our monthly live Q&A sessions with me. And we may even try to be able to convince and rope in Dr. Slazak, who I hope he doesn't make me look like a neophyte in this space. But these live Q&A sessions, I'm going to be putting out, like I said, little short TED Talks and frequently asked questions, everything from the myth and the history to current recommendations and guidance and everything in between. My goal is to educate. It's free. You can access it. Patient, not a patient, I don't care. What I want is to help you and help as many people as I can. And the only way to do that is to be upfront, transparent, and give you what I have. Tell you what I know. Share with you what I've learned as a doctor and a patient. This education is critical. We also want to provide that library of reads, what we recommend for books, what we recommend podcasts, what we recommend for studies and literature. We're going to help provide that and make that accessible to the public. It doesn't have to be just a patient, right? We're on a mission to bring the benefits to life and change the optics, change the stigma. Let it help everybody get out of their own way and use something that has been used for centuries, millenniums. We're going to do this together, all right? Talk a little bit before we close out. I want to tell you a little bit about Kratom, CBD. I just noticed kind of misspelled that. Kratom is with the O. And I'm saying that because I want you to do your own research and look things up. And CBD and turmeric. Now, turmeric is an Indian spice. If you go to your mom's house, it'll likely be in the cupboard, okay? However, at the pharmacy, they sell it in encapsulated form. The literature supports the antioxidants and anti-inflammatory properties of turmeric, and it puts it up on that level with prescription level anti-inflammatories, NSAIDs, ibuprofen, meloxicam, Celebrex, Mobic, all that stuff, right? But all of those, they did a heart trial in 2012, and heart's an acronym, I don't even remember. I think it's 2010 or 12. Came out and showed that the NSAIDs demonstrate a proclivity or higher incidence of precipitated heart attacks. So people with cardiac conditions can't really use the one thing that works fantastic for them for their arthritis and stuff. However, and it also, NSAIDs can cause peptic ulcer disease as well as acute kidney injury. So there, even something that you think is innocuous as ibuprofen might not be. However, turmeric, CBD have shown such efficacy for anti-inflammatory that I charge you to go give it a shot and try it. Now, I've heard anecdotally that some of the turmeric with black pepper in it seems to work better. I'm not going to speak to that specifically or endorse that. I've just sort of heard. And I don't have because you're going to see like 10, 20 different manufacturers. I don't have a recommendation. I can't tell you that one's better than the other. So again, I charge you, implore you, do your own research. It's your life. It's your health. It's your body. I'll give you all that I have, but there's a world of literature out there. Some of it right, some of it wrong. There's a lot of disinformation, but I always said, if it's one smart person tells me something, I'm going to listen, record it, think about it. If 3 smart people tell me the same thing, that's probably the direction I'm going to go. There's a whole lot of smart people out there that have done the studies and can tell you about this stuff. Listen to them. Give it a shot because it doesn't have the side effects and the other organ system involvement. All right. Kratom is one of those, I don't want to say it's in the shadows, but it's not mainstream. However, I've used Kratom before. I've tried it. I talked to a patient in our last seminar that really uses it and swears by it. Kratom is available. You can buy it legally in Ohio. You don't need a prescription. And it is a plant. It's actually leaves from the Maringatum species of trees that's mostly in Thailand. I think there's some other areas of Southeast Asia, like I think Cambodia. Don't quote me on that. But it has something called mitragine in it, which actually has been shown to work on the same receptors or similar receptors that normal pain meds like opioids work on, what are called mu-type receptors. It works so well that if somebody was in full-blown opioid withdrawals, if they took Kratom, it would at least neutralize it, right? And it does have psychoactive properties in it. However, it hasn't been tested, and it's not listed as any schedule. It's not controlled, doesn't require a prescription. But I can tell you personally that it works. Well, then why aren't everybody on it? It's tricky. When the kratom is just in its pure tea form or leaf form, if you chew on it or make a tea or whatever, it doesn't have psychoactive component. It's not until it's crushed and it's powdered and it dries that it actually has, it breaks down, turns into that byproduct of the psychoactive part. I think it's like 9-mitragynine or something. That's pretty close. That makes it work, and it does work excellent. But the problem is there's so much variation in it because it's not regulated, because it's not controlled, that you might get on a standard dose of 2, 4, 6 grams, however many times a day, and then you get a new bag of it and the dosing is completely off, right? You might take it and it didn't work near as well. You might take the same dose and give you that swimmy feeling and make you pretty nauseous. Now, there's ways to get around that, but I'm not going to go too far into kratom. But that's the problem with it, is that it's too variable. Okay, I am a proponent and advocate for it. It is extremely safe, but it needs to be a constituent of a comprehensive plan and not solo on its own. All right, so I'm going to talk about that now, but I will be having little small podcasts and short videos and FAQs and Q&A sessions where I can address and answer more questions about that. But, really kind of circling back, the medical marijuana, what's important about that, especially when you talk about dosing and stuff like that, medical marijuana is not intended to be smoked in its plant form. Why? How do you dose that, right? This is a medical treatment. It needs to be dosed. It needs to be recommended at a dose and at a time and a frequency. So you can vape it. I'll talk about the routes of administration real quick. You can vape it, which is almost identical to smoking. With vaping, you will get likely that big head rush, okay? But it is not going to last as long. It's going to be quick and it's going to be useful, all right? But it's not going to last as long. There are also oils and tinctures, excuse me, that you can just put under your tongue or in your mouth. You can make teas. You can make other edibles with it. There are other edibles you can take. There is also transdermal patches that will last, right? And all these are given in a controlled dose from a dispensary that is regulated, that has been tested for impurities, for bacterial, for fungal, right? It's safe. It's controlled. Okay, this is why. Now, we got a slide. It's called the endocannabinoid system, right? That is a system in your brain, your central nervous system, in the hypothalamus, that specifically is there for the processing, response, and utilization of cannabis. Okay? We have a system in our body. Our body is ready for this. It's designed for it. Just like opioids and why they work in that same region, the hypothalamus, there's something called the pro-opioid mineralocortin system, right? It's before the HPA or hypothalamus pituitary axis, okay? But our bodies and our brains and central nervous system are specifically designed for this. Why in the world are we not using it? Our body is not designed for ACE inhibitors. ACE inhibitors are designed for that. There's all these medications that are designed for us. Our body is designed for this. And look at what it does. It plays a role. Pain management, sleep, stress, mood, appetite, memory, control, muscle, liver, digestion, metabolism. And if you look at all the terpenes, you can cross match and reference. And man, I have these 3 symptoms. This is how it impacts my life. Our providers are going to help you line out that comprehensive system. Okay? I want to help you. Dr. Slezak wants to help you. My team, my family. That's why we're here. Okay? So how does this work? How does it start? So many people say, I've thought about it. I want it. I want to try it. I don't know where to go. I don't know what to do. Okay? Our website, trustedcareohio.com, will tell you everything you need to know. It'll walk you through it'll answer your questions. It'll give you our contact number. I'll put that up here in a minute. tell you when our seminars are going to be, give you links to our live and recorded Q&A sessions and Zooms. You don't have to make this decision now. Educate yourself. Ask us questions. Send us emails. Call us. Okay? But the way it starts and the way the process works, you have to make an appointment with a physician who is certified to recommend in the state of Ohio. Certified to recommend actually means the recommendation of treatment of your medical condition with medical marijuana. Okay. There are over 600 physicians that have what's called the CTR stipulation on their license and as well as their DEA. There's not many of them practicing, and a lot of that has to do with insurance and regulatory things and policies within interstate programs, but doesn't matter. I am a certified physician, licensed, fully licensed, unrestricted with the certificate certified to recommend. So is Dr. Slezak. So you make an appointment after you look through our website. You're going to click that book an appointment. During that time, we're going to get your medical records. We're going to help you get everything you need to meet the medical legal requirements. Okay, and we are here to help you. You don't have to do this alone. If the website trips you up, if our links trip you up, all you got to do is call us. If you don't have an email, because you got to have one, I'll tell you about that in a minute, just call us. We're here to help walk you through this. Okay. So once you do all that, you book an appointment, you see your doctor. We do the evaluation based on your medical records, your history, your current set of symptoms. If we not only feel like you would benefit from it, but you have also qualified from that medical legal standpoint, we'll give you a recommendation. That recommendation gets forwarded directly to the Ohio State Board of Pharmacy, excuse me, and the Ohio Medical Marijuana Programs Registry. The Board of Pharmacy will send you an email and you will register with them. Once you register with them, they will send you a digital card that you present at the dispensary to get your recommended medical marijuana. Now, one of the problems is the dispensaries don't always have what the physician recommends. I see this as a problem. If I've talked with you for an entire medical appointment and I have decided that this specific ratio or this strain or this strength or this hybrid is going to work best for you, and put it in conjunction with maybe CBD, turmeric, kratom, or combination of those, I need to make sure that you have it, right? So we are establishing relationships with the dispensaries to not only know their inventory on hand, but also recommend make sure that they have your specific recommendation in their inventory, so that when you go there and they know that you're coming, you're going to be able to get what we recommend as close, if not the exact recommendation. What else we do different, why we are new on the block, and why it matters. Here, let me advance to the next slide. Not quite. Why we are here and what makes us different. Let me pull back. Go forward one, please. Thank you. So what sets us apart? So like we talked about, we've got the monthly live Q&A, the follow-up, the monthly newsletter, and education. But again, specifically, when we make our recommendation, we are going to coordinate with the local dispensary. You let us know which one you plan on going to. And we're going to do our best to make sure that they have exactly what you want, not just the strain, the recommendation, the dosage, all that, but do you want the oil? Do you want the tincture? Do you want gummy? Do you want a combination of those? Do you want to take the vape in the morning to get that energy up and going, and a little bit less, a different type in the afternoon, but at night you want to calm down, you want to sleep well, so we take the gummy, so it just, right? So this is a whole plan. You got to make sure that you're getting what we're recommending. Right? So all these things are what sets us apart, what makes us different. You're not going to find this as an industry standard, because I believe the industry standard is rather indescript. But when we came on scene and we decided that we were going to run this practice, we paralleled what I believe every patient is entitled to, what every patient should expect. All right. And which is really look forward to doing that with you. So, all right. So let's kind of wrap this up. I've been talking for a while. I have a couple questions. I got emails, and I don't want to go too far into this because it's so personal. But I'm sorry, Richard had just recently asked, and just spoke with him. He asked about like contraindications and specifically with medicine. And one of those were like, is there medications that can't be taken? And the shortest answer is hard to say. It depends, but medications that are processed by the liver by something called P450 enzymes. One is I got this light in my face. Anyway, things like warfarin is one of those. Okay, now does that mean that you can't take warfarin? I don't know what's going on with this light. There we go. That's a little bit better. Sorry, guys. And there it's back. It has to end up right on my face, doesn't it? Anyway, so yeah, warfarin being one of those ones. P450 enzymes, don't worry about all the fancy name for it, but they are enzymes in your liver that process these specific medications. And warfarin is one of those ones, it's a blood thinner that you really can't mess with the levels because those affect your coagulations and could either lead to a stroke or cause you to be hyper anticoagulated, which could be problematic for bleeding and stuff like that. So again, that's not exclusive. Does that mean you can't take medical marijuana if you're on warfarin? Well, no. One, I would ask why you weren't on one of the novel drugs like Eliquis or all the oxybans, okay? Because they are not affected by it. But the other thing is, if you're on warfarin, but you do still want to try the medical treatment with marijuana, then you just talk to your coag clinic, tell them that you're going to be trying this, and rather than doing your INR every 6 weeks, maybe for 4 or 5 weeks, you go in once a week just to check it and make sure that it's not affected. Okay, so it's not exclusive. I had another question. Sorry, what was her name? I think it was Miss Wendy. Miss Wendy, Miss Mary. Sorry, Miss Mary had asked me. One of the questions was the fibromyalgia, but then another one is the insurance. Does insurance cover this? And the shortest answer is no. The reason for that is that it's still federally a Schedule I narcotic, despite the fact that they have deferred to the states to basically run their own processes. And so anyway, insurance doesn't pay for this. You will have our consultation fee or a full evaluation fee. Please go to our website and look at those and look at the explanations. It's a one-time for the evaluation, and then the renewals once each year, which is about half the price. Excuse me. There's also the registration with the Board of Pharmacy. And the registration with the Board of Pharmacy, I think first year is like $50, unless you are a veteran or indigent status, which you do have to submit your documentation to them for that. But then that's 50% off. So it ends up being like $25. Then at the dispensary, if you're also veteran or indigent status and prove that, there's a pretty substantial discount for the medical marijuana there as well. And a lot of people ask, well, what is the cost? Well, that's so variable, right? It depends on how often you use it. There's some people you can give a pain medication to and tell them use it 3 times a day as needed, and 7 months later it's still in their cabinet with only 3 gone. Then there's other people, you give them that 30-day supply, and by God, they're going to take it every 8 hours. And there's nothing wrong with that. That's how it's prescribed. But then that's only going to last 4 days, 7 days, right? So its cost is contingent upon how much you use, how frequently, okay? And how strong. You can get much stronger. You can get way weaker. You can have it titrated down to where there's barely THC, but an equal blend of THC, CBD. So don't be scared. We're going to take it reasonably slow and titrate up, okay? If you want to be aggressive, we can do that. If you want to be a bit more conservative, we're working as a team, your team, okay? It's individualized for you. Okay. Guys, there is a mountain, a world of questions and answers, and I wish I could give them all to you right now. I do submit, you'll see the number on the screen. Guys, if you have a specific question on something to determine if you want to evaluate this, hey, call us. It's our 800 number, 484-5305 and listen to the for the extensions. You can leave a message with any of us if you don't get a hold of us. We will call you back. We look forward to calling you back. You can also send us an email at support@TCN, which is Trusted Care Network Team. Well, that's obvious. .com. So support@TCNteam.com. You can email us, give us a call. Okay, visit our website. We're going to be doing live seminars, shorter ones each week and a large one each month. I'm going to be putting out videos with, again, all these little topics, questions that I get in that I think applies to many, many people. My own personal experiences, my own personal love for this and desire to help people. So we're going to have a large cache of video assets to help you through this, answer questions, get to know me, and know where I'm coming from, why this matters. Okay. We're in this together as people, as citizens of the earth. We're in this together with my team as a Trusted Care Network, but I want to be in it with you, give you everything that I have to get your life back to functional, to get your life back to enjoying it, to get your life back. I look forward to helping you. I look forward to answering your questions. We're going to be a national brand, a national presence. We are the Trusted Care Network. I really look forward to helping you. I thank you for your time. I thank you for your attention and look forward to talking to you. Have a great day.